Welcome to the place where we gain knowledge through the lens of creativity. I am Aaron Dworkin, and this is Artful Science. Thanks again for joining me here on Artful Science. Today's show is Depression, the Science of Sadness. And my guest is Olusola Ajilore, who is at the University of Illinois Center for Depression and Resilience, where he's a professor of psychiatry in the University of Illinois College of Medicine. Olusola, welcome to the show.
Thank you for having me.
So, I'd love to just dive right in. We're all generally familiar with depression, but I would prefer if you could kind of really help clarify it for us, right? What is depression? And what I mean by that is from a layperson's, from an artist's point of view, what's kind of the difference between, I lost my job, this thing happened, issues, in my family, I'm sad, versus long-term negative emotional mental effects. How do we really clarify what depression is?
Yeah, so certainly those things, those types of losses can trigger clinical depression. But when we talk about clinical depression, it's more than just being sad. We're talking about how it affects your body in terms of changes to your sleep. Sometimes people sleep too much, sometimes they can't sleep at all. It can affect your appetite, either not having an appetite or eating too much. It affects your energy level, as well as your ability to focus, concentrate. So it's in addition to the emotional feelings of sadness, you have some of the physical symptoms of depression that affect things like sleep and appetite. You can also have situations where people feel overwhelming guilt. They think a lot about past mistakes. And then as well as suicidal thoughts, thinking that life's not worth living, or have thoughts about wanting to hurt or harm themselves, is what separates just everyday or day-to-day sadness from what we call clinical depression.
Got you. That's very, very helpful. And so is there something that happens? In other words, why do we get depression, right? I would think sometimes there really are life circumstances that are so acute, it is beyond just being sad about it. It causes depression, but is it also something physical? And how do we get depression, if you will, right? It's probably a terrible way to put it, right? Some people might think, like, can you catch depression, right? Like, in other words, how do we get it? Why does it usually manifest?
Yeah, it's a really tough question to answer, and it's something that scientists like myself are still trying to figure out. But it could be a combination of some kind of underlying biological vulnerability, like genetics or the way the brain is wired, and then environmental factors like those stressors that you were referring to before, like the loss of a job or the loss of a spouse. So it's often the combination of some kind of underlying risk factor that we might inherit or develop early on in our childhood, and then an additional environmental factor. So it's often the combination of the two that can increase our risk of developing depression.
Gotcha. And is there any, kind of threshold, or, without actually going and seeing someone, is there some kind of individual threshold or triggers that we can look for ourselves if we feel like we may be beginning to have some of these symptoms? Is there something that should trigger us? You know what? Now is the time I really should go and see someone who is an expert, who can really help me diagnose this. Are there certain things we should be on the lookout for that lets us know it really has gotten to a state where we probably need additional assistance?
Yeah, so to meet criteria for a clinical depressive episode, you have to have most of those symptoms that I talked about on most days for at least 2 weeks. And when it begins to affect your function, either how you're getting along with other people, or how you're able to do your work, or if you're in school, how you're performing in school, that's usually when it merits attention from a professional, when it starts to interfere with your ability to function on a day-to-day basis.
Gotcha. Okay. And that's good. So there really it's not kind of a few days, but something where there's some level of longevity to it,
Exactly.
that sustaining aspect to it. So
Right.
for those of us who really do experience and get depression, does it go away? Does it ever go away? Can we ever consider ourselves, once we have experienced depression, kind of cured of it?
Yeah, so I have a lot of patients who always ask me about this, especially when starting medication. Is this something I have to take for the rest of my life? And what I usually tell them is that if it's a first episode, sometimes people can have one episode of depression, recover, and it'll never recur again. Other people have recurrent episodes of depression. And for those folks, I always recommend continuing treatment, continuing medication, continuing therapy in order to prevent future episodes from happening. So even if they're fine in the moment, they're on medications, or maybe they're seeing a therapist, if they've had a history of repeated episodes of depression, it's safest if they were to continue treatment. But if it's the first time, or maybe they've just had two episodes, then you might consider stopping the medication. But it's hard. We never talk about a cure in our business. We always talk about treatment. And oftentimes we want to sustain those treatments to prevent trouble down the road.
Gotcha. And is there, because you had referenced too, right, that there are some of the factors that may cause the depression could be these external factors, family, loss of job, those types of things, but then also actual internal biological genetic factors that
Mhm.
might be at play. When we think about those, do we have any understanding of what percentage of depression is caused by either internal, genetic, physical, or external circumstances?
Yeah, it's hard to say what the breakdown is because we still haven't really teased out what are all of those genetic factors. People have identified a couple of candidates, but we don't know how those genetic factors combine to increase risk. And then even when looking at environmental factors or external factors that contribute to somebody getting depressed, sometimes people can't identify a trigger. But what we do know is that having a history of childhood trauma puts one at increased risk. And there may be things that people have experienced in their life that they wouldn't even consider a traumatic event, but it still puts them at increased risk of getting depression.
Gotcha. Wow. So I mean, it's really, it seems like it's there, the reasons for it are complex and the ways in which we can treat it are complex, which I think kind of takes me to my next question, which is that, there are definitely some people, I think I probably count myself in this group, that are always reluctant to take medicine. If I have
Mm-hmm.
a headache, I don't just quickly pop an Advil. I usually wait, and then the headache gets really bad, and then I like take it, but kind of as a last resort almost. For those who are reluctant to take medicines, is there an issue of kind of the use of drugs versus exercise or other natural remedies for various mental health issues, and especially depression that we face? How do you view that?
Yeah, so I think things like exercise, diet, all of those are important factors in managing depression, but I don't see it as an either or thing. I think both can be utilized. And for people who have a reluctance to take medication, I think it's important to understand that, while for a long time we've considered depression to be more of a social thing or a psychological thing, there is a biological component to it, and medications can help. And oftentimes people are okay with taking medications for blood pressure, for diabetes, but then they have a problem taking it for depression. And what I try to do is try to get them to understand that depression is a disease of the body, just like hypertension or diabetes. So it's important to treat it as such.
Gotcha. And I think you're landing on such a critical component, which is that we still seem to view depression or other mental health challenges in a different way than, headache, or I broke my leg, or, whatever, or blood pressure, et cetera. And okay, that's very simple. And here's a drug to address it, but that somehow our brain is separate from the rest of our body in terms of how it's treated. And do you find that is an ongoing just issue of perception, and does it make people reluctant even to seek assistance?
Absolutely. There's been a lot of stigma around mental illness and how we treat mental illness. I would say, though, what's been heartening for me as a clinician is over the past few years, I'm seeing some of those barriers that have prevented people from seeking out mental health treatment in the past have been coming down. And they've been coming down because of, people in the public eye, whether it's entertainers, whether it's athletes, being more open about their own mental health struggles, making it easier for people to seek out help.
Gotcha. And so thinking about that and thinking about mental illness and mental health challenges that people experience, there's depression and anxiety, and I often hear them kind of being wrapped up in the same thing. There's often centers that are both depression and anxiety. Is there a difference? Are they basically kind of the same thing? Do they manifest in the same way? What's the distinction between depression and anxiety?
Yeah. So first of all, there's a lot of overlap. A lot of patients, maybe 30 to 50% of patients with depression also have some anxiety symptoms and vice versa. So there is clearly a lot of overlap. Where they overlap is probably in brain regions that are involved in helping us regulate our emotions. Where they're distinct is sort of where sort of the focus of the negative emotions lie. So, for example, in depression, oftentimes people will endorse feelings of guilt, and they'll ruminate. They'll think a lot about past mistakes or think about, past errors or past sins and feel guilty about that. Whereas with anxiety, they worry about the future. There's a lot of negative thinking about the future. So it's the same process, but focused in different directions.
Interesting. Got you. So literally one's projecting, reflecting backwards, the other's
Projecting forward. Yep.
Fascinating. Awesome. Well, unfortunately, we are just about out of time, but I always like to ask my guests, since we are at this cross section of the arts and sciences, and there's always so many similarities, do you have any actual arts practice that you do or arts interests?
I love music. I consider myself a very amateur DJ.
Nice. Very cool.
So I have a mixer, I have a turntable,
Very cool.
and I play to an audience of either one or two if I include my daughter.
Well, that sounds great. That sounds great. Well, Olusola Ajilore, thank you for helping us gain knowledge through the lens of creativity here on Artful Science.
Thank you for having me once again. It was a great conversation.